Hello, everyone. Thank you for joining the NAFSA International Education Town Hall on Mobility and Management. How will COVID-19 shape the new normal? My name is Joanne Ng Hartman. I'm the Senior Director for IEM, ISSS, and Volunteer Engagement at NAFSA. International educators across the country are planning for a return to student mobility, recognizing that the landscape and environment is no longer the same playing field compared to 2019. We're very grateful today to have agency partners and international education leaders with us to discuss and share insights on multiple challenges and issues that continue to unfold daily. NAFSA takes a proactive, multifaceted approach to address issues of importance that have deep and broad impact on our community. This is done either at an individual association level or collaboratively through our coalition partners. Next slide, please. Now for a little tech check today. The event draws on a lot of bandwidth, so you can improve your performance by limiting traffic to close out all of the other programs that you have. Or if you experience a delay, it may be a result of bandwidth at your location and you may need to reload. And in the rare case that the technology goddess is not on our side today and technology fails, please check your email for further instructions. The recording for this town hall will be made available through the NAFSA website in a few days, so please check back there if you're looking for the recording. Before we begin, here are a couple of reminders as well if you're having sound issues. You can also adjust your screen to accommodate your preferences when we're showing the slideshow, and if you need the interpreters, we have 2 with us today. Please adjust to accommodate your preferences. Next slide, please. I am really thrilled today to have such an esteemed panel with us. This is where I would say hold your applause if we were in person, but in the interest of time, I'm gonna do some short introductions and you're welcome to read their full bios on our webpage. Dr. Adria Baker from Rice University. Amongst many of her accomplishments, Adria was awarded the NAFSA KISS Award of Excellence as well as NAFSA's Advocate of the Year. Catherine Ibelke is at Montana State University, Bozeman. Catherine was the founding member and is the current chair of the Travel Health Coalition of the American College Health Association, or ACHA. Dr. Cindy Friedman is from the Centers for Disease Control and Prevention, and most recently, Dr. Friedman led the cruise ship task force for the COVID-19 response. Jeff Gaskill with the U.S. Department of State is the managing advisor to the group responsible for the department's travel advisories.
This is the interpreter. I'm not being seen on the video.
And last but not least, Dr. Kelpin Trivedi oversees international programs at the University of Massachusetts Amherst. He is the chair-elect of the International Education Leadership Knowledge Community and a member of the Governance and Standards Committee of the Overseas Security Advisory Council, or OSAC. My colleague, Caroline Donovan-White, will be moderating the Q&A discussion later. I also want to thank Aaron and Myra for all the behind the scenes technical support and everything else in between of this event. Next slide, please. To help get a sense of who's in the audience, please take 20 seconds to complete this poll on your primary KC affiliation. Next slide. Here's an overview of today's program. And next slide, please. One more, Caroline, thank you. So current challenges and issues, as if we needed reminders of these issues that international educators are facing as we try to grapple with a return to normalcy. Planning for in-person return, knowing that you have faculty who enjoy teaching virtually and don't want to return, or trying to solve the puzzle of juggling hybrid, high flex, and everything in between. SIOs and upper administration, meanwhile, are also focused on ensuring institutional infrastructure, including technology, staffing, and funding, are in place to withstand any sudden shifts. Risk managers continue to monitor the changing situations coupled with travel advisories issued by the CDC and Department of State, and not to mention complying with your state and local mandates are all equally vexing to all of us. And then you throw in the discussion on vaccine and testing requirements. Whether students, researchers, travelers will need digital health certificates or passports to be eligible to enroll or participate in study abroad programs. Today's panelists will share their expertise, insights, and some helpful planning tips as we set the stage for the challenges and issues that all of us are facing now. So let me hand it over to Dr. Cindy Friedman from the CDC to lead us off. Cindy?
Okay. Thank you. Thank you for inviting me to participate in the town hall today. Today I'll be going over CDC's travel health notices, how we determine a country's level. I'll also go over CDC's latest travel recommendations, and then touch on issues specific to study abroad and verifiable vaccination certificates. Also, some people refer to that as health passports. Next slide, please. So CDC advises even fully vaccinated travelers to pay close attention to the current situation at their destination before traveling internationally. The travel health notice is a good place to start. CDC uses primary and secondary data sets to determine the COVID-19 travel health notice levels. Primary criteria include cumulative case counts and case trajectory information provided by overseas ministries of health directly to the World Health Organization. CDC also relies on other sources such as Our World in Data and Ministry of Health websites and our own CDC offices around the globe for secondary criteria, which are the number of tests that are conducted per capita and the test to case ratio. And that's important because we want to make sure when a country reports very low levels of COVID that they're actually doing enough tests to detect it. All criteria are measured over a 28-day period and are reviewed by CDC daily. The changes in travel health notice levels are updated on a weekly basis. Next slide, please. CDC's COVID-19 travel health notices share a common 4-level structure with the Department of State's travel advisory system. In March of 2021, Department of State updated their COVID-19 framework used to assign COVID-19 travel advisory levels to be based primarily on CDC's travel health notice determinations. Department of State also takes into account other non-health related metrics like crime, infrastructure, etc. So after the March update, approximately 80% of the countries had a Department of State travel advisory level of 4, do not travel. This does not necessarily indicate a new change to the current health situation in a given country or to the CDC's travel health notice level. It really just reflects an adjustment in the Department of State system to give more weight to CDC's existing travel health assessments. So I want to explain or try to explain why are the travel health notice levels so high worldwide. You can see all the red on this map. And this situation at the moment is probably due to 3 things. The spread of variants of concern that are more transmissible, along with loosening of control measures and low vaccination coverage or no vaccination coverage in many countries, which all create an environment conducive to transmission. This is really a race between vaccination and reducing transmission with other interventions while everybody is getting vaccinated. And the blue map here is showing one of the variants, B117, and how it spread globally. And this is a highly transmissible variant. And you can see the blue on the map. Next slide, please. So although the world map is very red and there are some hopeful signs. So if you take a look here at Israel, it's an example of how the use of an effective vaccine can really drive transmission down. The top graph shows the percent of the population of Israel who are fully vaccinated since the beginning of the year. And on the bottom, it shows the daily new confirmed COVID-19 cases in the same time period. Next slide, please. So we know that vaccinated travelers are less likely to get and spread SARS-CoV-2, the virus that causes COVID-19, and they can now travel at low risk to themselves within the United States. CDC has recently updated the travel guidance for fully vaccinated travelers, and fully vaccinated travelers traveling domestically do not need to get tested before or after travel or quarantine after travel unless their destination requires it. Next slide, please. Currently, authorized vaccines in the United States are highly effective at protecting vaccinated people against symptomatic and severe COVID-19. Additionally, there is a growing body of evidence suggesting that fully vaccinated people are less likely to have asymptomatic infection or transmit SARS-CoV-2 to others. So fully vaccinated international travelers no longer need to get tested before they leave the United States on their outbound journey, and they no longer need to self-quarantine after travel on return. But international travel still poses some additional risks, and even fully vaccinated travelers might be at risk for getting and possibly spreading some of the new COVID-19 variants. And therefore, fully vaccinated travelers vaccinated must show proof of a negative test before boarding a flight back to the United States. And it's still recommended that they get tested 3 to 5 days after returning from travel. Next slide, please. So despite the good news for vaccinated travelers, I think that students in international and others in international programs can face unpredictable circumstances, as I'm sure many of you know. In the host country where there is a high burden of COVID-19, there may be local restrictions, including restrictions of movement. If the healthcare system is overwrought, there may be difficulty accessing medical care, even for simple things like a broken arm or an accident or emergencies. There may also be mandatory quarantines and difficulty accessing testing, which is important for their return to the United States. Next slide, please. So institutions planning study abroad programs should really check CDC's destination-specific travel health notices for information about the COVID-19 situation in the host country. Programs should advise students to get fully vaccinated before traveling and be aware and follow all airline and destination entry requirements, such as testing, vaccination, mask wearing mandates, and quarantine. They should consider getting insurance to cover any emergency evacuation. And if the travelers are high risk for severe disease, they should really be encouraged to discuss their plans with their doctor. Next slide. So I know there's increasing interest in verifiable vaccination credentials as it relates to travel. And currently, proof of COVID-19 vaccination is not required for anyone entering the United States. Many US government and international groups have been working together on verifiable vaccine credentials. CDC has been contributing public health subject matter expertise in this process. And what I can tell you so far is that there will not be any central federal vaccination database nor a federal mandate requiring everyone to obtain a single vaccination credential. We believe that vaccine credentials should be widely available, accessible in digital and paper formats, free, and meet equity standards. Verifiable vaccine credentials will meet privacy, security, and anti-fraud protections as well. And this work is ongoing, and so it's in process, and I'd be happy to take some questions, but that's where we are right now. Next slide. I think this is my last slide, and I just wanted to close with a few comments. Just to reiterate that CDC uses data-driven approach to assess COVID-19 risks and to provide recommendations to travelers. I think that programs need to consider the travel health notice level and local restrictions when planning a study abroad program. And finally, I just think the key is to be flexible. I know it's a challenge when trying to plan a program, but as a public health official and a mother, I'll give you some of the same advice that I gave to my son, who is a rising junior and majoring in international studies in Arabic and is desperate to go to the Middle East for a semester abroad. And I told him that there are two factors that are likely going to decide what happens, and that's the timing of his program and the situation at the destination. I suggested to him that the spring semester next year might be better or more realistic than the fall semester, or maybe he should even consider going abroad the fall of his senior year. I also told him that he should not be wedded to one destination, but to have a backup country. Well, I'm not sure how well my messages resonated with my 20-year-old, but I hope they have resonated with you, and I'd be happy to take any questions. Thank you.
Thanks so much, Cindy. We'll now move on to Catherine.
Thank you so much, Cindy, for your comments, and thanks to NAFSA for this, the honor of this invitation. And I just wanted to offer a few practical kind of on-the-ground tips from the perspective both of a physician assistant who practices travel medicine for the last 25 years, both at a destination clinic in Kathmandu, where I saw lots of incoming students, and for the last 20 years here at Montana State University, where I've coordinated our international travel clinic. It's also through the lens of the American College Health Association, where I'm a member of the task force for COVID-19 for the last 13 months, and also the founding member of the Travel Health Coalition. Many of these comments will be available in the third iteration of the American College Health Association guidelines, which we are working on right now and which should be out in the next couple of weeks. And there are links to these on the Town Hall website, and they'll also be available afterwards. So I am hoping we all have our unique situations at our institutions. And what I was hoping to do is provide just a few ideas that might resonate with you in your own practices that you might be able to take with you and use at home at your institutions. These are things that kind of repeatedly can be issues that arise. So I think the cornerstone is absolutely communication and collaboration. So this existing across the campus and the community can make an enormous difference for the success of our international travel, both outbound and incoming. The way that we approached this at Montana State years ago, and it has proved to be incredibly helpful with COVID, is creating a standing committee of relevant parties. And some of those that you might want to consider would be, of course, the Office of International Programs, but also Student Health, the offices of the administration, including President, Provost, and Dean's offices, Safety and Risk Management, General Counsel, faculty representative, University Communication representative, maybe Office of Commissioner of Higher Education, Board of Regents, and others who can contribute and feel valued in making these decisions. And as Cindy said, adaptability and agility has become even more essential to the entire international education process. And identifying and utilizing health and safety resources and expertise, as Cindy just discussed, of course, is a cornerstone for moving forward. Next slide, please. Thank you. For outbound travelers at a level of program institutional considerations, of course, access to current information, which Cindy just discussed, and there are many fabulous resources for this, including CDC, US Department of State, OSAC, and many that will be discussed by Calvin and Adria as well. Destination considerations as discussed, and we'll go a little bit more into that in a moment. Insurance has been mandatory here for a number of years, including evacuation and in destination country. Is it even available or an option for students to get, especially if there's a level 4 State Department travel advisory, which I know we'll be hearing more about later in the program today. We did have a number of incidents that finally convinced our institution to develop a travel registry years ago. I think this is essential, and this is something that in the age of COVID is even more important as we move forward. And again, all of the unknowns and creating expectations which can't be met, I think is always something that we're sensitive to with international travel, and on a mental health level and an anxiety level for our students and faculty, trying to plan programs, being very transparent and being very communicative is essential. And the other thing that's incredibly important, out of the standing committee that can be agile and nimble and meet at a moment's notice, the decision about who makes the final decisions at your institution about whether travel is going to be allowed or not is something that's so important to define at the outset and to make known. And frequent discussions and making known of these regulations and decisions is incredibly important. Next slide, please. At the student and faculty level, health and safety considerations for outbound travel, of course, are many. I think one of the things we've found to be most important is pre-departure orientations for students, also faculty and staff. We do not allow any travel to take place at Montana State University internationally unless they have attended a pre-departure orientation, and it does have a strong health and safety component. And it includes now these solid COVID knowledge pieces and also encouraging them to bring COVID-related travel items. Do we want to do much more solid pre-travel health screenings now, both for physical and mental health issues because of the potential for destination countries being very strained in terms of what they can offer our travelers. Emergency and communication planning has always been vital, but as we saw last February and March, even more so now. Vaccine considerations, as Cindy mentioned, incredibly important. One thing that's come up a lot in the last 2 months, the timeline. You're not supposed to get other vaccinations within 2 weeks before or after any COVID vaccinations that we offer in the United States. This has created big issues with some of our students who are traveling for personal travel. What are other needed immunizations? And don't forget to mention the continuation of COVID precautions post-vaccination, really letting students and faculty and staff know this is incredibly important to continue in higher risk situations. What is going to be acceptable documentation, both for vaccinations and testing? What type of testing is required? How can it be accessed? What is the appropriate documentation? And do they need documentation of recovery if they have had COVID infection in the last 90 days? This is a special situation that the Student Health Service could work with you in that situation because a PCR test is not going to be acceptable. And again, accessing healthcare abroad, what are the considerations there, and what are the availabilities of all-cause care, including accidents, mental health issues, which are the leading causes of trip interruption or early ending. Next slide, please. And just a couple of words about incoming international travelers. I think this is, again, a big situation that we need to really consider and communicate well about and do it collaboratively, including with our community partners, accessing CDC information, Department of State information. There is a lot of conflicting information about what's required. What is the quarantine requirement? For how long? What happens if you've been vaccinated? Do you need to, as Cindy mentioned, the CDC recommendations were updated yesterday for vaccinated persons. But we need mechanisms to address this and make these requirements known, maybe a website that's updated frequently. Clear messaging is vital, and establishing communication that's not just for our incoming international travelers as students, faculty, and researchers, but also our guests. Again, as mentioned, testing and vaccinations incoming, where are they available, who pays, what are the plans for quarantine and isolation if needed? And how can we support our students, including with challenges involving xenophobia, isolation, and other issues? And again, a strong incoming orientation and making available to students resources for COVID prevention. And just wrapping it up, as we started, all of these things are cornerstones in considering international health and safety considerations for travel. Thank you so much.
Thanks so much, Catherine. So please be on the lookout and check the ACHA webpage as well as our handout for the links to the guidance that ACHA will make available for the fall. Now we turn over to Kalpin and Adria for institutional perspectives. Kalpin.
Thank you, Joanne. I will be concentrating mostly on the outbound side of things, and my colleague Adria will be talking a little bit more about the incoming student and international student travel side of things. So we're going to just give you very quickly a snapshot here of what was the old and what is the new normal at the University of Massachusetts Amherst. And we have, unlike, I would say, a lot of US institutions, we did not restrict international mobility in this last year. We've had limited study abroad actually in fall of 2020, spring of 2021, and we're planning mobility for the summer of 2021 and beyond. And you'll see, though, that our numbers are greatly reduced, as you might expect. We've been trying to work kind of collaboratively across the institution to make sure that we were able to support all our students and faculty and staff, both from the international side as well as on outgoing travel, study abroad, and research, professional university-related travel. Next slide, please. So I'll start with an overview of our fall 2021 opening plans. We will expect all faculty, staff, and students to return to campus for in-person this fall. We're hoping for as normal a fall semester as possible in the new and the old sense of the term. We will be requiring vaccines for all undergraduate and graduate students for any kind of teaching, research, or campus-related activities, and also strongly encouraging faculty and staff to get vaccinated. We will provide accommodations for students who cannot get here due to visa and travel and other restrictions. And again, Adria will go a little bit more into detail on that side of things. And we will also allow small in-person gatherings and obviously sort of planning with flexibility for any public health and safety and COVID-19 situations as they may evolve. Next slide, please. So I'd like to talk a little bit about how we approach travel risk management at the University of Massachusetts Amherst. I am grateful to Cindy from the CDC for talking about a data-informed way of looking at travel. And we foreground a data-based approach as well at the university. So we look, traditionally we have factored in state and CDC advisories. We've given them high weight in our risk assessment matrix, but they've never been dispositive for us. We also look at a number of other sources of information, such as our insurance and intelligence providers, other sort of allied and Five Eyes government advisories, other sources of data, such as the Global Health Security Index, WHO, our World in Data. And currently we are paying a lot of attention to COVID-related data from things like the Harvard case metrics and the Johns Hopkins information. So we're really sort of trying to make sure that we are able to assess travel risk holistically at each destination and then offer either limited education abroad and exchange opportunities where we think that they are feasible and safely possible, and then also allow faculty and staff research or other university-related mission-critical travel to take place while ensuring that we can adequately support all of these populations. Next slide, please. And this slide should just give you a little bit of a sense of our current risk assessment matrix. So you'll see this is our COVID-19 risk snapshot right now, where we're tracking case rates from various sources. We're tracking vaccination levels, and this sort of goes into then making a determination around whether or not this will be a spring 2021 study abroad destination, for example. So on this slide, you can see that we have, Denmark and Australia as allowable. That's as much as I could fit into this snapshot, but it also shows you the range of work that we're undertaking across different factors to assess the viability of any destination. Next slide. So when we look then at what's happening to our travel policies, from the on the undergraduate side, we're really doing a bespoke and granular assessment of every location in terms of study abroad. And our philosophy really is to think about it in terms of whether a program or a study abroad is available, which is to say, is the host country offering it? Is the host university or the partner on the ground offering it? Is it allowable? Have we determined based on our own risk assessment that it is safe for a UMass student to participate on this program? And finally, is it accessible? Can you actually get there? Is a student able to travel? Are there health and safety considerations that we need to be thinking about? So we're really sort of reviewing at this point, how we can carry on doing study abroad expansion gradually through 2021-22, but I imagine we will be keeping mobility relatively restricted just so that we can have a good handle on all of these factors. In terms of faculty staff approved travel, what we're doing is reviewing each travel request individually at several levels and gradually beginning a loosening of this process starting in summer of 2021. In fact, the first step of that was just published on our university website today, where we're loosening up travel to CDC's level 1 and 2 countries with certain caveats. Next slide, please. And so I think I just wanted to sort of, in conclusion, say before handing over to Adria, that while we have always looked at the CDC and the State Department as being important advisories for us, the duplication of the CDC's guidelines into the State Department have made them marginally less useful for us because it masks the risk of other things like personal safety, terrorism, political violence. We're now in a world where travel to Finland or France is rated a higher risk than travel to Sudan or Haiti. Where everything is a level 4, nothing is a level 4. And so, we're really sort of drilling down and doing this granular assessment for ourselves. But I think that this is not always going to be possible for smaller offices that don't have the bandwidth to do this kind of granular work. And the ex cathedra sort of interpretations of some of the agency statements could have a deleterious effect on their international mobility. Adria.
Thank you, Calvin. Thank you so much for having us. Greetings from Houston, Texas. Warm day today, and we're grateful. I'm very grateful to be invited. I'm coming from Rice University, which is a comprehensive research institution of about 7,000 students, which is about to grow even more. But 24%, or really 1 in every 4 students that we have in our population are international, and we have about 1,000 scholars. So for a small institution, we are very international, and across the board there's a concern of the students getting here because so many were not able to come from last fall, last spring, and so there's been a little snowball effect. And then, but we're grateful that we think that there's some good news coming down the pike, and I'll talk about that in a minute. So fall 2021, we're planning to be all in person, everything open, but with the understanding that the international students may not be able to get a visa. So there will be some accommodation and teaching online for that. We've had 2 clinics, actually 3 clinics, vaccinating clinics. I'm grateful for what our institution has done. They have really taken the guidelines very strictly and helped us to stay well. There's been some very strong leadership, a lot of expectations that was communicated. but to have the vaccines on campus, and then we've partnered with the Texas Medical Center. So there were Rice clinics and also now medical school clinics that are on campus to make it easy for our community and our families to get vaccinated. They've followed very careful testing and social distancing, and but recently in the last few days, they've relaxed some of that on campus. Even when we were outside, we would do masking. And even when our state said, you know, that masking is not required, our institutions still took a different stance. And quite frankly, there was many times that the state would do certain things and say certain things, or the county would say different things, and being a private institution, we would manage through that. For travel, right now, for the summer, there is not really travel that's that is supported by the university unless there's something approved. But we're standing to find out what's going to happen for the fall. Going into communication, though, it's very difficult because the international office is kind of in the crust of all the communications that are going on, and things change. I say I have a whiplash job because whatever happens in 1 minute, it's going to happen differently in the next second, and we've seen that in the last couple of days. Fortunately, there's been some good news and hopeful news there. But so we always report on what is going on at that very moment and let people know that this is subject to change. And at the same time, you know, this is stating the obvious, but always with a lot of empathy and kindness. People are going through a lot. Everybody, the students, the departments, the administration, everybody is, and everybody's having to manage a lot of things. So, you know, sometimes we're in the midst of a crisis. We may need to just kind of step back a bit and remember that we're all dealing with things. But in the end, you know, the ultimate decision-making in our university is with the crisis management leadership, the provost and the president. Fortunately, our office has been very well connected with them so that we can know what's changing, how things are changing. And then in communication, we're just transparent. We address things as best as we can at the time, and not what we hope it would be, because many departments would like to say, well, it doesn't make sense this, and we've heard other universities. No, we just address what we know. And sometimes it's not what people want to hear at the moment, but it's what we know at the time, and it can change. But there will be some things from this past year, months, that we will keep, I'm sure, and as we move forward into the new norm, you know, keeping some of the online meetings and thinking outside the box in every second, and more rotating schedules possibly, and then just different kind of venues, multi-level venues. So I think, you know, some of the things we'll learn some best practices from it. Next slide, please. But the thing that's really been difficult for the international students and scholars and foreign nationals coming here is that every decision has a domino effect. And so I consider that there's 4 pillars. The pillar is A, what's the status of COVID? And of course we see how things can change so rapidly. Our thoughts and hearts are with India right now, and how quickly that developed and how that changed so many things. Then you have the academic decisions on campus. What is going on? What do they want in person completely? Do they want hybrid? What is it? Any of those academic decisions can change and will affect everything. Also the ICE laws and how that affects everything. And then the U.S. consular visa processing, and they are all intertwined. And if one shifts a little, all of those are going to shift. And if another decision, and we saw this just in the last week when we went from different academic decisions to where then ICE rules came in, and then the visa, and then the code. So that makes it difficult. And that's why I say it's kind of it's a day by day, moment by moment situation. And that's what's been hard to communicate to departments, because and across campus sometimes. So, you know, we just focus on what's happening at the time and communicate as best as we can. The reactions on campus have been pretty strong. I mean, we still have the students, I feel like, are still getting great teaching, and they're getting some college life. We're a residential college system, so there's a lot of campus life. But yes, is it the same as before pre-COVID? No, but we're trying to get there. And I think that what we focused on is what we can do and how we can do it, even if it's reduced. Like Kalpin was saying, a lot of things are reduced, but what can we do and celebrate those things that we can do and then grow from that. We will just continue to grow again. But we always just, you know, we have to look at travel, internationals coming in. That is you know, there's a multi-tiered opportunities for them in terms of if we can be flexible for them when they come into, if they can't come, they have to do things online, but then being as flexible as we can in terms of onboarding them when they're at different times. It's not just a one shot where before we could do everything one way. No, we're doing a multi-tiered. And also just we found with international exchange, because of that, we've been able to do some outreach and opportunities. We've had opportunities that we haven't had before. We've always talked about online orientation and done some of those things, but now that is just a part of our life, and we're doing more communication, different kinds of communications with outreach, with recruitment. We've heard many, many opportunities that we didn't have before. But I think, you know, in my closing comments, I would say we just need to be, you know, hopeful, and, you know, there's a lot of hope out there, and patient, creative, and advocate as we can. And I just want to give a huge shout out to NAFSA and Public Policy for the Advocacy Day, because I think some of many of things that were positive and that have happened in the last couple of days are a result of NAFSA and what they're doing. And just to know that we're in the middle of the communication avenue, and people are coming to us, and we have to just figure out really great ways to communicate up, out, around, within, and that it's going to be subject to change, and how can we do that at a moment's notice. Thank you so much for inviting me, and we wish you all the best, because we know it's a challenging time, and but there's a lot of hope out there too. Thank you.
Thanks so much for sharing your perspective, Adria, at Rice University. And now we have Jeff with the Department of State. Due to some unforeseen technical difficulties, Jeff is on the phone with us, so I'll hand it over to Jeff.
Thanks, Joanne. Just based on those technical difficulties, can everyone hear me?
Yes, you're good to go.
Okay, perfect. Thanks again. You know, in a previous life, I was a professor of comparative politics and also a Fulbright Scholar alum. So this is a real familiar kind of audience for me, a real comfortable space. It's kind of like coming back to my roots. So I'm really pleased to be with you all today. In addition to my role as the Division Chief for American Citizen Services in East Asia and the Pacific, as Jan mentioned, I oversee the Department of State's Consular Information Products Working Group. And that's the group that is tasked with developing and publishing the department's travel advisories. It's pretty clear from the panelists here that many of you are probably quite familiar with our travel advisories, and maybe even more familiar after our recent round of updates. But as you probably all know, the current version of our travel advisories are a relatively new product, and we are continually revising the data and methodology on which they're based. Right off the top, I'd just like to make a couple of general comments about what we believe the travel advisories are and aren't. They are the State Department's most comprehensive and broadly stated official assessment of a range of country-specific risks, including crime and terrorism, kidnapping, hostage-taking, civil unrest, health, and natural disasters. However, we don't intend for the travel advisories to be prescriptive in a binding way. We see them as one of many possible sources travelers and expats can consult to make more informed decisions about traveling and living overseas. And as such, they're aimed at a general audience, not specific traveler profiles. So travelers with, say, a very high tolerance for risk, or travelers who have specialized institutional support or other personal resources, should consider that the travel advisors are not necessarily written with their circumstances in mind, but rather just as a general overview for what we might maybe sort of call the average traveler. Our travel advisors are relatively brief. but they are linked to more detailed country information pages. And more recently, we have mandated that all of our overseas posts maintain a COVID-19 information page, which is really a pretty rich source of information about country-specific COVID conditions, not necessarily the kinds of conditions that CDC is looking at because they have a different sort of expertise than we do. But the COVID-19 pages are a great clearinghouse for information about current entry and exit restrictions, including any exceptions that might be in place for students and academics or other category-specific travelers. Of course, our travel advisories aren't the only risk assessment tool available. I was really interested to see how Amherst is developing matrices to evaluate risk. And sometimes our travel advisories are not the most appropriate tool for all travelers. As other people on the panel have mentioned, our Canadian, Australian, UK, New Zealand colleagues all maintain their own kind of travel advisory products. And with those 4 countries in particular, we collaborate and coordinate closely. We often share data with them or receive data from them and have weekly meetings with them to discuss both our products and the risks that our products attempt to describe for the traveling public. In addition to those partner countries or like-minded countries, of course, the US government has a number of other products. The FAA publishes advisories. OSAC was already mentioned, and obviously our CDC colleagues. We ourselves work with academic and public sector experts whose research and consultancies often inform our travel advisories. As you know, earlier this month, we updated all of our travel advisories, and the update was not meant to signal a change in states' assessment of the epidemiological conditions in any country or set of countries. Instead, the change reflected a significant revision in our methodology for assessing risk. Cindy did a fantastic job of kind of outlining how state and CDC have tried to calibrate and align ourselves more closely, but state does look at a broader range of not just non-COVID related risks, but COVID related risks as well. Some of the risk factors that we take into account now, which we did not previously take full account of or took account of in a different way, were factors that we became aware of during the global repatriation effort. So most of you remember that starting around March of last year, the State Department ramped up our efforts to bring US citizens who were stranded overseas or having difficulty getting back home from overseas destinations. We gave them a little bit of an extra facilitation, in some cases providing charter options, in other cases working with private sector providers to bring folks home. And we learned a lot about how the pandemic can affect people, not just in terms of the risk for getting COVID, but in terms of the challenges that people have getting back home or dealing with immigration or local law enforcement or local health officials overseas. So the new methodology looks at a number of additional factors beyond CDC's travel health notices, but all of the travel advisories do include CDC's travel health note. And while that does mean that there is more than one quantitative indicator in each of the travel advisories, we've always hoped that folks would look at the travel advisory as more than a number. In other words, dig down a little bit into the travel advisory. It was mentioned earlier that, you know, if many or most countries are 4, it can become difficult to sort through what the real underlying risk factors are beyond COVID. But we do encourage people to look not just at the number, but at the specific risk indicators that are associated with each travel advisory, and then the actual text of the advisory and links from the text to other resources. Given current global conditions, most countries around the world are assigned a level 3 or a level 4. In a relatively small number of cases, our TAs are set at a higher level than CDC's THN. And this is almost always the result of country-specific conditions we believe may make it more difficult for US citizens to enter or exit a destination, or which might present challenges to them complying with current US reentry requirements. We know that our recent travel advisory changes generated a lot of discussion, In fact, we were even briefly TikTok famous based on a Washington Post produced clip. And I thought about doing a little travel advisory dance for you all. Unfortunately, the video is not working, and my teen daughter convinced me that that would be a really bad idea anyway. So we'll dispense with that. But we do want you to know that we have heard and share your concerns about how the travel advisory changes might affect academic exchange and study abroad. Like you, we at State know how valuable academic exchange is for students, faculty, and for the local and national economy. And although we continue to encourage the general public to reconsider overseas travel at this time, we also update our travel advisors regularly, and we very much look forward to a world more favorable to study abroad. To close, I'd like to just flag a few things that I think offer us some glimmers of hope. Although many countries continue to severely restrict entry to U.S. citizens and other foreign nationals with a consequent effect for the travel advisory, many of those same countries have put provisions in place to exempt students and academic researchers. So again, have a look at those COVID-19 pages for each of the specific destinations, because you may find that although the travel advisory is high based on general restrictions, students may be able to get an exemption from those restrictions. And as we've mentioned earlier, since we're not aiming specifically at students, you can take into account how those exemptions might play into your evaluation of risk. Also, as many of you know, the Biden administration has already announced the expansion of national interest exemptions for European and Chinese students wishing to travel to the U.S. And it's often the case when the U.S. makes changes of those kind, other countries will find ways to reciprocate. So I think there's reason for optimism there. And while details are still being worked out, the EU has announced that it will begin lifting travel restrictions for vaccinated U.S. citizens to travel to Europe as early as this summer. And several individual European countries are also pursuing their own local policies for possibly admitting a larger number of U.S. citizens, including students. So we're certainly far from where we'd like to be, but with vaccines becoming increasingly widely available for U.S. students, we're hopeful that many of the most attractive study abroad destinations will soon be open and available to you and your students again. And again, just want to thank you all for the chance to address you. We were a little bit of a late add to the panel, but our contact information is with your team at NAFSA, and I'm happy to be available for further outreach. Thank you.
Thank you, Jeff. Thank you so much for reaching out to us and joining us for the panel today. There have been so many questions coming in over the past little bit, so I'm going to pull those up on my screen here so that I can get to those. Calpen, lots of fans out there about your travel risk matrix. Let me just say that right away. A lot of people asking about that as well. So let me get to my questions. So the first question I have that came in from our audience is for Cindy. Cindy, can you repeat the frequency that you said that CDC would be reevaluating the advisory levels? I want to make sure, one of our questioners wants to make sure that she heard you correctly.
Yeah, so we look at the data every day, but every Monday, I think I was looking at some of the questions. Somebody asked, what day do we do that? Every Monday, so weekly, we post new travel health notice levels. We look at the travel health notice, the incidence rate or the case counts and the trajectory over a 28-day period, and that's 2 incubation periods. And that's important because you wouldn't want the travel notice one week to be high and the next week to be low. So we give it 2 incubation periods to stabilize. Now, I will say that we just updated our methods a little bit to take into account countries' vaccination coverage. So for example, Israel, those graphs that I showed you where they have very high vaccination coverage and their case counts coming down, we didn't wait the full 28 days to de-escalate them from a level 4 to a level 3. We took into account their vaccination coverage, and we were able to de-escalate them to a level 3 sooner. And so we will be doing that. We're always looking at new metrics as more and more countries are able to sequence and we get better data on, you know, the proportion of virus in countries that are these variants of concern. We may take that into account as well. So I hope that answered the question.
Thank you. Calpen, my next question is for you. Are you ready?
Sure.
Okay. How do you recommend that institutions review their policies for travel based on factors other than, you mentioned the 5 I's point of view, so lots of questions about what that means, but a lot of institutions aren't quick and nimble in responding to these things and may not have the resources of a Rice or a UMass. So what recommendation would you have for those institutions?
So very quickly, the 5 Eyes is the intelligence alliance that comprises the United States and the United Kingdom, along with Australia, Canada, and New Zealand, the sort of allied friendly nations. And they all have their travel advisories and government travel recommendations as well. So they're often a good way to sort of corroborate what we're hearing from the Department of State. In terms of how other institutions that may be able to, smaller institutions may be able to do some of this work or share some of these resources, I think that's a very good question. A lot of academic institutions have traditionally relied very heavily on the Department of State because the advisories, as Jeff mentioned, are fairly nuanced if you dig into them. Now, of course, as we know, they're more or less sort of replicating the CDC. So even though they should be one of the several factors, it means that there's a lot more burden put on individuals and offices and educational institutions to go and do that for themselves, because there's a sort of redundancy there between the CDC and the Department of State. So I would say draw on NAFSA, draw on kind of your professional organizations like Forum. There's a lot of work being done around study abroad risk management there. There's a lot of good information sharing. I know, for example, talking about the risk matrix, you mentioned there were a lot of questions about that. So I know that the EA, the Education Abroad Knowledge Community at NAFSA, and the Education Abroad Regulatory Practice Committee, the EARP, are getting ready to push out or construct some sort of resource that would guide institutions on how to create such a risk matrix, what kinds of data sources can be used, how you might evaluate them. So I think really at this point, I would say that the professional organizations, your own network, the Academia Sector Committee of OSAC does a lot of good information sharing as well, and it's specific to risk management for travel security. So you may want to consider sort of benchmarking with colleagues there. But we're essentially sort of in academia going to have to maybe learn to depend less on the State Department's travel advisories as being this kind of ex cathedra pronouncement, and getting our institutions socialized, right? So talking to senior leadership, talking to the risk management folks, talking to General Counsel's office, and getting them to understand that what the Department of State and the CDC have just said in this forum, that they are one of various factors that institutions should consider, that they should not necessarily be dispositive. I know that it's been a shorthand for a lot of institutions, and certainly there are insurance considerations sometimes, because international travel insurance won't cover a level 3 or a level 4 country. So you may want to go back and renegotiate those, so that when you make that argument to say we need to move away from being strict adherents of the State Department's travel advisories, you can make the good argument to say, well, here's all this other data, here's what the field is doing, here's what our peer institutions are doing, and here's what NAFSA and Forum, other professional bodies are giving us to be the replacement.
Thank you so much. My next question is for Catherine, and I want to acknowledge that it's almost 4. We might go a little bit long, and I'll beg the indulgence of our panelists if they're able to stay great, and of our audience, but I think there are some questions we'd love to get to if you have the time. Catherine? One of our questions came in about best practices for collecting health information in pre-travel screenings. What are your thoughts about this in light of ADA and HIPAA compliance? Who should be reviewing this information, and what should they be looking for in a good time frame? Thank you.
Thanks, Carolyn. I'll just make it really brief, but would love to discuss this with anyone afterwards. This is an ongoing question that we've probably been dealing with in the Travel Health Coalition since its inception, like 10 years ago at ACHA, and ongoing at any institution I've spoken with. There are lots of different answers based on what the setup is at your institution. We have situations where pre-travel information is gathered and students have pre-travel appointments with me or with their providers. If there are any elements of concern with faculty-led programs, it's just openly discussed with the student and release of information can be shared. If it's gathered by study abroad offices, We've had people come to us without naming a student or giving identifiers and tell us about what the concerns are. And then from there, approaching the student and saying, hey, listen, I spoke with one of the providers at Student Health. Would you be willing to meet with them? And we can just figure out how best to deal with your either physical or mental health situation to make travel work for you. Because as we all know, it's not a reason not to travel. It's just a reason to prepare better for travel. So those kinds of open discussions with the student or faculty members, privacy being first and foremost, and sharing respectfully your potential concern and seeing about where that can go in terms of support that you have at your institution or in the community healthcare provider network.
Thank you, Catherine. Jeff, I have a question for you if you're able to take it, if you want to unmute yourself. Hi, Jeff. So someone asked a question whether or not you could expand upon your introductory comments about how the Department of State levels are aimed at general travel and are not necessarily meant to be binding. In particular, as Kalpin said, so many institutions rely on these in their decision making. So can you expand a little bit on what you meant there and possible just recapturing the other sources that you recommend?
Sure. Yeah. So the travel advisory, because we just issue, a single travel advisory for each country, and because our historical approach has been to aim at the general public, it's not written from the perspective of helping universities or any other more specialized institutions make decisions about whether or not it's safe for students or faculty or other professionals to travel. So the idea is that we're reaching out to kind of a general public. Sometimes I think I have a colleague who occasionally says, well, I think about, where I came from in Milwaukee, and I'm thinking about, like, how would I shorthand in 2 minutes for the guy sitting on the stool next to me who's just come off shift. So it's a much more general purpose tool. I think the second part of the question was, what are some of the other resources that might be available to people? So Kelpin pointed to the travel advisories from our partners in Canada, Australia, the UK, and New Zealand. I would say that in many of those countries, the travel advisory is a little more fulsome. And that's in part because we separate our travel advisory from our country information pages. And they typically fold into their travel advisory the information that we put in our country information page. But the Canadians, the Australians, the Brits, and the Kiwis all are providing right now what we believe are really good and rich sources of information. I mentioned FAA, others have mentioned OSAC, and of course CDC colleagues are on with us. I would also, I think I also flagged the fact that we do consult with some private sector experts as well as some academics and representatives of think tanks, particularly on really specific types of risk. For example, we have an ongoing dialogue with some colleagues at one of the local universities on Chinese practices, especially as relates to arbitrary detention and exit bans on U.S. citizens. So there's a lot of information out there. I think Kelpin's remarks were excellent, and I don't have any take issue at all with the idea that our product is just one of many products, and in some cases, for some audiences, it would be helpful to go broader than just states TAs.
Great, thank you, Jeff. Adria, I have a question for you about how, we know that students might have difficulty arriving in the US by the start of the semester. How at Rice are you talking about how you might permit students to arrive late or work with those students who are missing things if they need to become vaccinated? What are some of the conversations that you're having? Can you elaborate a little bit more?
Sure. So for this, we are having many conversations with students, a lot of communications with those coming in, and departments that are hiring, that are bringing them in, as well as town hall meetings and just a lot of communication there. So we are accommodating, if they cannot come in by the latest, we have the date that they're supposed to come in on their I-20, their DS 2019. If they can't come in on that date, we can push it back for a couple of weeks because there is kind of a late ad drop that they can do. But unfortunately, after that, we're asking them to, they have a couple of options. They can defer to another semester, and we're allowing some accommodations for that, for some scholarships to continue on. We're allowing them to choose to do classes online, which we're grateful that the academic programs switched. They pivoted quickly when they found out that the international students may still have problems getting visas. It went straight from all face-to-face classes and we're all going to be in person to, oh no, internationalization, international students are critically important to our campus, so we're going to do courses online if they need to for those people who can't get a visa. Or then they have the option to just, so they could start classes in the fall online, and then they could come in the spring to start their classes in person. So deferring or doing online or just coming in a little bit later. And then we're just in a lot of communication with them. In terms of vaccinations, we're waiting. They're not requiring vaccinations for everybody right now, and we are recognizing vaccinations from abroad. So if someone has been vaccinated from another country and it's not one of the versions that's being used in the United States, we will recognize that. However, it'll remain to be seen how they're going to monitor that. We're still looking at, is it going to be required or not?
Thank you. There were lots more questions that we simply don't have time to get to today, but there was a ton of information to digest in this presentation, and we will be posting a recording and the slides on our website as quickly as possible so that you can go back and review some of what was said. I'm going to turn it over to my colleague, Joanne Hartman, to close it.
Thank you so much. Again, my heartfelt gratitude to our panelists today, Jeff, Adria, Cindy, Catherine, Kelpin. Did I forget somebody? This was such an invigorating discussion. I hope you have some good information to help you plan a return to mobility. So thank you, thank you, thank you. Here are some upcoming events. As Caroline mentioned, there will be a recording on our webpage in a couple of days and a resource handout that's already up on the webpage, so feel free to download that PDF document. As always, please, please, please submit your questions and be on the lookout for updated information. We'll be sharing your great questions with the panelists as well, and hope to see you at the 2021 NAFSA Annual Conference. Thank you and have a good afternoon.